Good morning and welcome to the weekly COVID-19 update. I'm Kerri Schuette, the Public Information Officer for the Shasta County Health and Human Services Agency. With us today, we have Robin Schurig. She's the Director of the Public Health Branch of the Shasta County Health and Human Services Agency. Dr. Karen Ramstrom is the Shasta County Health Officer. Glen Hayward is representing Redding Rancheria. Mark Mitchelson is representing Shasta Regional Medical Center. Brandon Thornock is representing Shasta Community Health Center. Robert Folden is representing Mercy Medical Center Redding, and Judy Flores is representing the Shasta County Office of Education. Thank you everyone for joining us. We'll start as we always do with the numbers. As of this morning, we're reporting that yesterday we had 162 new cases, including 105 who are hospitalized and 16 who are in the intensive care unit. About a quarter of our cases today are in children who are under the age of 17. We'll turn it over now to Robin Schurig, the Director of Public Health, and for her weekly update.
Thank you, Kerri. Good morning, everyone. I'll share a little more on the latest data, starting with cases. The CDC's 7-day case rate is 465.35 cases per 100,000 population in Shasta County over the 7-day period of September 1st through the 7th. Again, anything above 100 per 100,000 is considered high transmission, so our extremely high transmission in the 400s is being driven by the Delta variant, which is much more highly contagious than previous strains of COVID, as well as by the low vaccination rate in our county. Our vaccination rate is inching up slowly, with the latest data showing 45.6% of eligible Shasta County residents, so those aged 12 and older, fully vaccinated, and 55.6% with at least one dose of vaccine. This is still low compared to the state as a whole as well as the nation, but it is heading in the right direction. For hospitalizations, there are 105 people hospitalized with COVID in Shasta County, including 16 in the ICU. And as we've reported previously, the vast majority of our cases, hospitalizations, and deaths have been in people who are unvaccinated. And we share this in order to convey the effectiveness of vaccination against infection, but especially against severe illness and death. Vaccine remains the most effective way for us to protect ourselves, our families, and our community from COVID and from severe illness or death from COVID, including providing protection to those under 12 who aren't yet eligible for vaccine. It can also help keep our businesses and schools open, because while we have seen an increase in cases among school-age youth, many of the school closures, both locally and elsewhere, have been due to staff being out with COVID or on quarantine. And we've also seen local businesses close temporarily due to staff shortages as well. So if you're vaccinated, you're less likely to get COVID, and if you get exposed, you don't need to quarantine as long as you're not having symptoms. Other things that people can do to reduce their risk of getting COVID include masking, avoiding crowds, especially indoors, and staying home if you're sick, except to get tested. Those are my updates, and I'll turn it over to Dr. Ramstrom.
Thank you, Robin, and good morning, everybody. Today, I want to appeal to our employers and other leaders in our community. This virus is with us for the foreseeable future, and its transmission is person to person and driven by our personal behaviors. We need to stop fighting the prevention recommendations. They're tools to support our livelihoods in our community. And our employers and leaders across various sectors will benefit by embracing these tools. We want people to be able to work, to support their families, to contribute to the workforce and delivery of goods and services and infrastructure that our community relies on. We have several examples of our community leaders stepping up, including people on the screen right now, which is amazing. Yet we've heard many examples from our community members who are frustrated because they've done the right thing and they still experience COVID-19 infection in their family. That's because someone else hasn't been careful, someone at the grocery store, someone at the coffee shop, someone in a restaurant or at an event. Our behaviors really matter and affect other people. As Robert has shared many times, no one is coming to save us, it's up to us. It's time to stop fighting the prevention measures we know make a difference and encourage their use. Whatever measures make sense in your work setting, whether it's masking, distancing, ventilation, moving outdoors when feasible, encouraging vaccination for those who are ready, and maybe sharing your own story about getting vaccinated. Layering on all of those measures is never 100% effective when used by themselves. So the more layers, the better the protection. Stacking the Swiss cheese, as we've referred to it over the last many months. And letting employees know, hey, we need you, your family needs you, your community needs you. So, as they're heading out the door, have a great weekend, be safe and have fun, because we can do both. We can be safe and we can still live our lives. For those employers and leaders who've already modeled the way, thank you. Your efforts matter. We are so appreciative. Please keep doing what you're doing. We know it can be challenging, but it's making a difference. And for those of you who haven't yet committed, now is the time. Your community really needs you. Our children need you. Our families need you. So we hope that you can step up soon. Thanks.
All right, thank you, Dr. Ramstrom. Let's go to our healthcare partners. Let's start with Robert, and then we'll go to Mark Mitchelson.
Hey, good morning. So again, I think I would just like a huge shout out for staff and physicians. This extended pandemic is taking a toll on everyone. So as you can imagine, we have folks working extra hours, extra shifts, extra days. And I think what's distinctly different with this current variant are unfortunately the number of deaths that we're seeing. So, I think people hear those reported out in the community on a regular basis through the county, but I don't think we always put a face to those. And I have to tell you that it's starting to take a toll. When people put their heart and soul into their work and into caring for people, and then we get to that point where the effort, we can't sustain life, it takes a personal toll on people. So again, one of the reasons we promote vaccination is to reduce the impact of a disease. And I'm here to tell you, this variant is different than what we saw last year. So I'm not sure what else to say other than I'm proud of our staff. I'm proud of our docs for putting in the daily effort that they do.
Thank you, Robert. We are equally grateful for all of the work that all of your teams are doing. We'll go up to Mark next, followed by Brandon.
Perfect. Thank you, Kerri. So yeah, Robert, thank you for that. That was actually really great to hear. Many of our staff actually work at both facilities, and just seeing the collaboration between both hospitals has been really great for this past 2 years now, it seems like. But we are very, very busy. There's a lot of sick people. Just this last week, we've canceled our elective inpatient surgeries just because of volumes, and we have a lot more COVIDs than we've ever had. Big thing that we want to stress, similar to what we stressed last year, is, don't come to the hospital if you're not sick. Don't come to ER unless you have an emergency, because the volumes are there. Wait times may be higher than normal, and we want to take care of everybody. We want to take everybody who has an emergency and do it well. So, just be careful, be safe out there. But it is getting very, very busy. But just to what Robert was saying, thank you to everybody in the community that's doing all the right things right, because without you guys, we're not be able to do this.
All right, thank you, Mark. Next up is Brandon, followed by Glenn.
Thank you. I just want to share a couple of numbers we're seeing recently at the community health centers. On a daily basis, we have roughly about 90 folks who are presenting for the regular appointments or for appointments with urgent care who we're screening out with symptoms, and we're seeing about a 10% positivity rate out of those folks as we're determining whether or not they can go on to their regular appointments. Back to school notes, we're still getting an increasing number of requests for back to school notes. Just so folks are aware, if your child has potentially been exposed to COVID, but they're asymptomatic, the point of care testing is not prescribed for that situation. And so if you're calling or presenting, wanting a back to school note, it could take 2, 3, 4 days before you can get an appointment with your clinician. Then we take the test, and then the results we'll get in roughly 3 to 4 days to then create a letter and provide to you so that your kid can go back to school. But in many cases, you might as well have just waited the 10 prescribed days in quarantine than go through all that rigmarole. And so there's a lot of frustration around that, and we're doing what we can to accommodate folks, but that's really the reality of our situation. We're also, like many others, are facing an extreme staffing shortage. And so I checked with our HR folks, we have about 60 vacancies. So if you're out there listening and you're looking for a job, now's a great time to apply. We've got plenty of spots for folks. But I'm going to echo a little bit of what I shared last week. Please be patient with us. Please be patient at the other healthcare organizations and other organizations that are experiencing similar shortages. It's only going to get worse. With the looming deadline of September 30th of the vaccine mandate, we expect others to make a decision, unfortunately, to find work elsewhere. But the folks that are here working, they're in the trenches, they're here because they care, they're here because they want to help you. Please, please be patient. That's all I have for the update from the health centers.
All right, thank you, Brandon. We'll go to Glenn next, followed by Judy.
Thank you, Kerri. Echoing just what everybody else says, we're very busy. We're testing between 150 and 200 people a day, running about a 10 to 12% positivity rate. But the staff is doing great. Everybody's hanging in there. And we had root beer floats yesterday. So there's some good news too.
It's always a good day when you get root beer floats, for sure. All right, and now we'll go over to Judy from the Shasta County Office of Education.
Well, good morning. So Mike Freeman stepped in for me last week and was able to share what we put together last week for the first time, which was point-in-time data. And in conversations with both Robin Schurig and Dr. Ramstrom, we decided we would continue to do this point-in-time data throughout the surge. We won't do it all year, but we'll at least continue through the surge. So yesterday, as of September 7th, what we saw across our school community, and for this particular piece of data, it does not include students who are in independent study programs because they're not in classrooms. But when we think about those on modified quarantine, students on modified quarantine, which means they still come to school, but they need to be tested twice a week, we saw a significant decrease in that number. So we were at 625 yesterday. If you recall, last week it was just over 2,000. And part of that is some have struggled with being able to do the testing twice a week and have had to move to home quarantine. We have, as of yesterday, that one point in time, 1,663 students who are home on quarantine, which is 520 more than last week. And so last week, the number was 1,143. The other piece of good news is that we have fewer students with a positive case yesterday than where we were a week ago. Yesterday, there were 226 with a positive case, so that's 76 fewer than last week, where we had 302. But on the school staff side, continues to be more of a concern. So our numbers in both of these are higher than they were last week. So we have 134 school staff on home quarantine, which is 52 more than last week. Last week we had 82, and there are 65 school staff as of yesterday experiencing a positive case. And that is an increase of 16 over where we were last week. In looking at the Shasta County Public Health data for schools, their data will be released this afternoon. And so the data that I have for you to share is through August 31st, but we didn't share it last week because it comes out Wednesday afternoon. But at that point, there were 15 K-12 schools who had 5 cases or more on school campuses, and another 37 sites have had 4 or fewer positive cases for students and staff. And if you are interested, I can provide the more updated data later this afternoon in regard to the numbers of school sites with cases. In terms of school closures, right now we have two. A couple went back to school after Labor Day. So currently Anderson Middle School is out on COVID leave, except for their 7th graders who started a quarantine period earlier, and they actually returned yesterday. And then Excel Academy is also closed due to COVID and quarantines. So that's the update I have to share with you today.
All right, thank you very much, Judy, and to all of your school comrades who are doing this work during this bizarre time. We are ready for media questions.
Well, I've got one for either Mark or maybe Dr. Ramstrom. We had a story last night from Shasta Regional that they are not letting anybody go. They're allowing nurses to stay and being tested twice a week. Is that allowable under the state guidelines?
And yeah, Mike, I think when I read that last night, just briefly, so there's some talk about, you mean letting go as in firing. We're not at that point yet. We still have some little things to figure out. But, you know, we will comply completely with the state guidelines and mandates along, you know, whatever the state and public health advised. So everything will be to the T.
Thank you, Mark.
Other media questions?
Good morning, everyone. Anna here. I just wanted to ask, I was reading this article and it was like also a study done by the American Academy of Pediatrics that said kids account weekly for US cases about 26.9% of COVID cases here. You know, that kind of just goes back to the schools. I know Superintendent Flores had mentioned 2 school closures, but are we seeing any more possible on the brink of closures for other schools in our area?
Well, that's for some of our schools that have had the higher cases, it's a real issue, especially as you think about staffing. You know, we can have a large number of student issues and it not impact our ability to stay open, but you get certain staff positions not being able to be filled, and it does inhibit a school to stay open. And so that becomes the issue. You know, this week we saw increases in both those home on quarantine as well as those with positive cases. And that adds to the challenge schools face in trying to stay open. I know Mike Freeman shared last week that we're really struggling with the lack of substitutes. So some districts, especially our more rural ones, really don't have any substitutes right now that they can access. And then others who have emailed me back, and we've really been looking at the data, will say it's anywhere between 66%, 50 to 66% fewer substitutes for teachers and other certificated staff than pre-COVID. And then on the classified substitutes, whether you're talking about those who operate our food services, custodial, other areas, office staff, that there's been a 75% reduction in substitutes over where we were before COVID. And so when you put those pieces together, and I think Mike also shared that we are down, we currently have over 220 positions that haven't been filled since the start of this school year. And when you put all 3 of those pieces together, it's surprising that some of our schools that have had the most staff cases have been able to still stay open. So, you know, in terms of timeline, you know, every day is a new day. You're looking at new data and how you're able to manage with those staffing shortages. So I don't know. I mean, every day we're wondering if there will be another school that's unable to stay open.
Thank you. And I just wanted to follow up on that. I know Mike Freeman had mentioned it last week too, that modified quarantine is becoming an issue because it's hard to keep up with that. And you mentioned how some students, instead of doing that, are just going home to the 10-day quarantine. Could we see a possibility of modified quarantine just going away and we're just going to go straight back to the 10-day quarantine?
That's not my understanding. By October 15th, every school will need to have in place a testing program for staff. And so if anything, we will have greater capacity with testing on school sites than less capacity. We still have some schools that are gearing up toward putting that full testing system in place. But it is a challenge when your numbers are extremely large, and that's what we have seen with a few of our districts, the numbers being so large that they have struggled to keep up with the twice a week quarantine, twice a week testing.
I've got one for Doc. Oh, go ahead.
Sorry, go ahead, Mike.
I have a quick one for Dr. Ramstrom. It sounds like we're seeing more younger patients now hospitalized. Is that true, and how concerning is that?
Well, you know, as our case numbers among children go up, our case numbers overall go up, means our case numbers among children go up. And so the numbers of hospitalizations are going to go up. And we've been lucky so far, I think, that our numbers have been pretty manageable. We'll get our updated information from our epidemiologists on that tomorrow. But again, I think that we've been really, really fortunate so far. The other thing to keep in mind too is that if children are really, really sick, they often get sent out of the county to get a higher level of pediatric care in a hospital that's appropriate for them. So, but we would be tracking that. Sometimes it's a little bit delayed in us hearing about that and including it in our numbers, but we have pretty good communication with our hospitals. So they typically let us know about that. But you know, Robert could comment as well if he has seen any concerning patterns there.
So we really haven't seen that, and I think you covered it perfectly. Many times these kids need to go to a pediatric intensive care unit. We are preparing, however, for the day where we may have to care for some kids, at least for a period of time. And again, it just goes back to the nature of this variant requiring so much oxygen support compared to last year.
I have a question for Judy Flores and Kerri Schuette, Netta Atia at the Record Searchlight. Kerri, you mentioned that there were 162 new cases and a quarter of those are found in children under 17. My question is, do we know at all if that spread, if the spread of COVID is taking place in school, or are we able to tell through contact tracing if that spread is actually happening outside of schools? Do we know that at all?
We do. So the epidemiologist from Shasta County Public Health has shared that in the sites that I mentioned earlier, 12, we know through August 31st that 12 of the school sites have had transmission on the school campus. And those are all the sites, or all of those sites have had multiple positive cases and students on campus, students and or staff on campus while they were contagious.
Okay. And you mentioned also that there's the testing that's going to be set up by October 15th. Is that testing only going to be available to teachers, or will it also be available to students as well?
That will be a district by district decision in terms of what they have the capacity to take on. It's required for all staff who are not vaccinated. And so, you know, beyond that capacity, both in terms of testing units or testing kits, as well as staff capacity. So it will vary.
Hi, Anna here again. This one I'm going to ask for the hospitals and our clinics who are on this. Can I just get a number of how many of your staff is fully vaccinated, please, and thank you.
I'm going to start by saying no. And the only reason for that is because we don't have the updated count yet. So we're in the process of doing a survey so that we have updated numbers ourselves. If I had it today, I'd offer it.
Yeah, ours was in the article last night. It was about 70%.
I would say we're close to around 70% as well.
2 weeks ago, we were at 75%, but those numbers have been increasing a little bit slowly.
Thank you. And then this one's just kind of going, this one I guess will be more geared towards Shasta Regional and Mercy. You guys were talking about surge and we're seeing a lot more sick patients. How is, the ICU and bed availability looking like right now? Especially, I know, Robert, you had just mentioned like you guys are gearing up for possible, pediatric patients.
Yeah, so I'll start by just reminding us that at least here in Northern California, our ICU is often close to capacity of the 33 beds that we have, right? It's just part of the role that we serve. But in this pandemic, what we're seeing is more COVID patients in our ICU, and we've actually opened up some additional space outside of our traditional ICU to care for patients. So when that happens, we have to notify the Department of Public Health and whatnot. There's a whole, there are 3 times when we have to let them know when we've exceeded certain capacity. And we've done that twice already here in the last, I'll say in the last about 3 weeks. So, we've been cautious not to give the air that our hair's on fire, right? That we're crazy busy. But the reality is we're busy. And we're busy caring for many COVID patients. And there comes a time when we may have to have a conversation with the community about the reality of what we're going through right now. Because what we're experiencing is truly kind of historic. I mean, we're going to look back 3 years from now, 5 years from now, and go, wow, that was a pretty big event. But we're quiet about these big events. And the reason we're quiet is to a certain degree, and I know people have heard the term quiet professionals. You're not going to hear us say in healthcare or in EMS or in law enforcement or even at certain times in the military how busy or professionally stressed we are. And we do that because we don't want to create panic within the public. So know that, yeah, we're very busy. Know that we're prepared to do what we need to do. That's why we have staff working overtime on any given day. That's why we have people who are literally putting their name on a list to be called in if we have a need. And I think it's moments like this that, again, really make you proud, but at the same time kind of make you sad because we know that's taking people away from their families. We know that's taking people away from maybe doing something that they'd like to do outside of work. But we're busy.
No additions. Well said. Crazy busy.
Indeed. Any other media questions before we recess for the day?
Sorry, I have one more here. This one's kind of for actually Dr. Ramstrom. Dr. Ramstrom, you gave that really passionate message earlier at the start of our call. Right now, are you still seeing like some resistance maybe from people who, from either getting vaccinated or just trying to follow those guidelines of where, do the masking, do the social distancing, get vaccinated and stuff? Are we still seeing some of that hesitancy and all of that within our community?
Well, I think many of the people on the screen here and others are working to help individuals make their own personal decisions about vaccination. I think that's ongoing. We have seen that our vaccination rates increasing, but our case numbers are reflective of not fully adhering to those prevention measures, right? Because you can't get this virus if you're not exposed to it. And so, granted, there's some instances where we have to be in close proximity, such as in children in a classroom and their teacher in the classroom with them, and that's just the nature what we're, what we're trying to accomplish there. But that's why masking is so important in that setting, and why it's so important that those who are of age can actually get vaccinated, so that we provide additional layer of protection. But we wouldn't have the high case numbers that we have if we didn't have more of those layers of protection in place. And so that was the purpose of my statement today. And our healthcare institutions are feeling it, and the people who are being cared for are feeling it, as are their families. And we don't want that. We don't want that to impact. We don't want our community members to experience that. And it's preventable. And so the more people who embrace those prevention measures, the more protection our community has, especially for those who can't yet be vaccinated.
And Anna, another really good data point is to take a look at communities that have a high rate of vaccination and compare that to their current rate of hospitalizations. So if you looked at San Francisco, for instance, or the peninsula just south of San Francisco, you'll see that they have a high community vaccination rate and a very low community hospitalization rate. And you compare that to Shasta County right now, and unfortunately we have a very low vaccination rate and a very high hospitalization rate. And it's a crude comparison, but I think it's one that we have to really take a deep look at.
Thank you. I really
Robert, and just to add, Anna, and I think our North State is actually unique in the extreme of what Robert just explained, compared to other parts of the state who actually may have not as good vaccination rates as some of those areas like the Bay Area, but we're disproportionately high in terms of our hospitalizations and with low vaccination rates. And so I think behavior in addition to low vaccination rates is contributing to the hospitalizations for sure.
Thank you. And then just one more question, I promise. I was also hearing some things, reading articles that came across my view about a concern now about the Mu variant, sorry, Greek letters. So we have Delta, now we have another potential variant heading our way. How, as public health, is that kind of concern? We haven't seen a case here yet, but are we on the lookout for that too?
Yeah, so there's a statewide surveillance system that involves whole genome sequencing of specimens to kind of monitor what the dominant variants are in the state, and it continues to be Delta. I think the last numbers I heard was 96, 98%. And so we get those updates from the state every week, and we've only had, as of earlier this week, I think just over 200 cases sequenced in of that variant, the Mu variant in California. And so I think the Delta variant is so transmissible at this point, it's still sort of winning, if you will. But all of that's being monitored at the state level to ensure that we're aware if that shifts. So, but not the situation yet.
All right,
Thank you,
Dr.
and that's it for me.
Okay, we can take one more question. I'm sorry, there's another meeting that some of our crew has to get to, so we can take one more question if somebody has one more quick one. Okay, hearing none. Thank you everyone for being with us today. We will see you all again next week. Everyone stay safe and healthy.